Hello everyone, this is Dr.Vikrant Shah, consulting physician, infectious disease specialist from Zen Multi-Speciality Hospital, Chembur. Here I am today talking to you all about the rising cases of COVID what we are experiencing now. Two important things: A, not to get panic. B, you have to follow all the precautions. Why not to get panic? What we are seeing a variant which is possibly a omicron variant what we are seeing nowadays. And what we seeing in our patient is predominantly involvement of upper respiratory tract. Earlier variant, Delta variant, when patients were critical, getting severe illnesses wherein the predisposition was towards the lower respiratory tract. That is why we were getting a lot of COVID pneumonia. Patient used to get breathless, their oxygen saturation used to go down, and people were really vulnerable. This particular strain is very infective. We've seen multiple number of patients, their viral load is very high, that we are correlating with their CT value, what we are getting on the COVID RT-PCR report. But what is commonly seen is involvement of upper respiratory tract. Patients are presenting with fever, patients are presenting with throat pain, patients are presenting with runny nose, what we call it as coryza. Some patients are getting tiredness and fatigability, which is like any other viral infection. But what we used to see earlier in the form of loss of taste, loss of smell, confusion, so involvement of the brain, involvement of the multiple organs are not commonly seen. Patients are not really getting very critical with this particular strain. We're seeing younger population getting involved in this particular strain as compared to the older population what we saw earlier. What we are supposed to take in this particular scenario is symptomatic treatment. If you get runny nose, we give antihistaminics. There is tiredness, fatigability, so we use a lot of combinations of multivitamins, and only symptomatic treatment in the form of hydration, rest at home, isolation, use of separate toilet. So that is the standard treatment. People with comorbid conditions like hypertension, diabetes, coronary artery disease, people with disease modifying agents, on steroids, patients with COPD, or chronic lung diseases, what we call it as, and if fever is high grade. So in such cases, mild to moderate condition with comorbidities, we can offer antibody cocktail or a newer drug called as molnupiravir. But per se, only symptomatic treatment is what is required, along with routine steam inhalation and gargles with. So what are the preventive measures? So hand hygiene and respiratory hygiene. You should wash your hands frequently with soap, 20 seconds, with a proper hand hygiene which has been taught to all of us now. We've been seeing COVID since more than 2 years. And respiratory hygiene, use of mask appropriately, keeping safe distances, keep your immune system intact, prefer to have healthy food at home, and avoid the the activities like marriages, avoid going out when it is not really required. So let's join our hands together for a good cause, for reduce the burden of this virus, and let us hope that we should soon see pandemic getting into endemic, and we have a near normal life soon. Thank you very much.